Hi, my name is Heidi Waldoch, and I'm a licensed marriage and family therapist and owner of Bridging Hope Counseling. We are located in Rogers, Lino Lakes, and Buffalo, Minnesota. Today I'm going to be talking to you about what is a telemental health counseling appointment and how does it work with mental health. We just implemented this on Tuesday and today's Friday, so we definitely have a lot of questions coming up and we want people to feel comfortable with this. So I wanted to get out here and talk about what it is and help people to feel more comfortable with it. The definition of it is a provision of healthcare that allows remote means of counseling by telecommunication technology or with the telecommunications technology. So either with your computer or with your phone, but not face to face or in an office. So first off, I want to explain that this is a very compliant way of mental health. The medical industry has actually been using this for a while, and it's been very effective and very helpful for people who do not have access to either driving or people in rural areas. So it's definitely been something that they found a lot of benefit from, and are using it for many years. And I know that there's definitely a lot of therapists that have been using it. So it's an awesome opportunity for people to be able to access services. We follow all the applicable laws. So this includes federal laws, which is HIPAA, which is called the Health Insurance Portability and Accountability Act. So we make sure to follow that, all state laws, applicable local laws, at all our licensure ethical standards, and then the online standards and relevant rules. So it's an ethical practice, and most of the insurance companies are covering it, especially after what's been happening this week with COVID-19. Insurance companies are stepping up to the plate and paying for this. So we would say for all clients, so to still call and make sure that their insurance company does cover it. So that is something that we would suggest. Make sure that your insurance covers it, but most of them are. And a lot of them are making exceptions for this to make sure that that clients can access it. So how it works is you can call and set up an appointment just like you normally would. You call our number and set an appointment with a therapist, and she'll send you the same email that you get if you would sign up for as a session at one of our offices. And so you set up a portal and you fill out all the online questions that we have, and she also will send you an informed consent, a credit card form, and any authorization that you need of release for someone else. And one of the informed consent that you will get will be for telecommunications. And so there'll be some details on that about the informed consent, kind of the details of it, that it's confidential, that we're using electronic means, and it's just between you and the therapist. And the program that we use is called Zoom. Other agencies will use different programs like DoxyMe or even FaceTime, and there's many programs that therapists can use. So with our clients, you can either download it, an app on your phone, which is pretty simple, but that you could also use it on your computer. And I'm just going to show you what it looks like when you pull up the app on the phone. This is what it looks like. So there's just 4 little buttons here. It's pretty simple. This is kind of what it puts. This is start, join, schedule, share screen. So a pretty simple app. And, when you would use it on your phone, you just kind of show that, and that's what you use. Otherwise, when the therapist sets up the meeting, they will send you an email with an invitation for a meeting. And so you click on this link and it'll go right up into either your phone, the app on your phone, or the app on your computer. And all of a sudden the screen will be up and you'll be seeing yourself. And you click on this and have the software, and then you want to click the select video and audio. So sometimes you might not show up right away because the video might be off. And so there's all these little bit of technical glitches that sometimes you have to make sure to figure out. But once we have instructions that I'm actually looking at right now that we will give you in an email, so you'd actually have these instructions that are super helpful. And so you select video, you select audio, make sure that they're on, and then you join, and then you will be on with the therapist. And when you're on, you will basically see yourself and them. And so there's a screen with you and there's a screen with them. And when you're in the meeting, and it looks different whether if you're on your phone or if you're on the computer. So I can't say like the detailed specifics of it. But when you're on the computer, there's a little black bar on the bottom that says unmute or start video. So you want to make sure both of those are on. And then also in the bottom right, there's a leave meeting. And then with some, you'll have a button that says chat. So you can actually chat too. Because when you are face-to-face by video, it can be uncomfortable sometimes for people. And so to have that chat option is really nice. And then when the time is up, so you kind of go through the session, the therapist will then schedule for the next appointment, and then you'd hit the bottom right leave button on it. And so when you're in the appointment, it feels exactly like what it's like watching me, except for you see yourself too. So that's the only thing that's different. And it's by video, you just want to get yourself comfortable, get a cup of coffee or a water, and make sure that you're in a comfortable setting. If there's a lot of things going on in your home and there's a lot of kids or a lot of people there, maybe go to your car. We've had people that have gone into their car for appointments. You can even drive your car maybe and park by a nice lake or a pond or a park. So you have something that you can look at. You can really be creative with these appointments. And that's what's kind of nice about it, is that you can do this really wherever you are. Some benefits of it besides that is that it allows you to be able to be flexible with scheduling with your therapist. There's greater access. Like I said before, people in rural communities wouldn't normally have access to this, now can have access to mental health sessions. One of the big things for me is why I even started doing these videos even before this week is that we really want people to feel comfortable with coming to counseling that would never go. And so we're hoping that offering telehealth appointments will allow people to want to come that maybe wouldn't have came in the first place. And so one of the first videos that we did was talking about vulnerability and just being able to be more vulnerable. And even me being on these videos is vulnerable for me to do this. And we just want people to feel more comfortable and see that, wow, I could do mental health. You don't need to drive to an office. You don't have to take that time. Nobody has to see you when you're going in. You can do it from your own home. So it's very private. The other thing that's really cool about it is allows you to see somebody with a specialty that you wouldn't normally have been able to see because it can be by telehealth. Instead of having to drive really far to see someone. So that's a really cool option. You can do the session from anywhere, like I said before. And then another one is that let's say you have some sick symptoms, but it's really not that bad, but you don't want to go in and get somebody else sick, you can still do the session. So sometimes we cancel because I'm not feeling well or there's something going on, and now you can actually keep the appointment. And so that's a really good benefit. And I told my therapist, you can do this in real time. So I think that's a really cool option. That maybe if there's something that you're struggling with and they can see you struggling in that moment, it's a really cool way to have somebody. It's kind of like coaching, we're counselors, but you can be coached through something we can be in a difficult place, and at the end of the session you can be at peace. And that's really what we hope for when we're doing counseling, that you can move through things and that we don't stay stuck. There is hope, and we can get through this. So we want you to be able to feel comfortable. We do understand that it can feel a little bit awkward at first, like even when I started doing these videos and getting more comfortable doing them. But if there are questions that you have with feeling uncomfortable, that's okay. That's kind of part of it. But some people are like, oh, I do that all the time. I FaceTime my friends all the time. This is no big deal. So we just recognize that everybody's at different places with that. So let's say you want to have a family member join. Can you do that? Yes, you can. It's just like if you would do family counseling in the office. Either they come and they join you in the screen, or they would join you from a different computer. And we can do that. So we can join different people into the meeting, whether they are in a different location or a different location in the home. You can do that by different, we just need their email. So we can do that. And then one thing that I think some people get worried about is if we record them. We do not. So sessions are not recorded. So we want to make sure that people know that. And then cancellation fees are the same. So just please make sure to let your therapist know. If you can't, let them know within 24 hours. That's the same. So that's something that we appreciate people to be able to do. That's basically telehealth. It really is just doing it by the same way that I'm talking to you right now. But we really want people to feel more comfortable with this, and so that's why I popped on here. And it's changing, and we're learning all the time. So we really, really appreciate your feedback. We appreciate your feedback. We appreciate your comments, letting us know how we can improve and how we can get better at this. I'm sure some of the forms that we have we might be updating those and changing those. It seems like there's changes every day, and so we just want to stay current and stay up to date and be able to keep providing the service. I heard a really cool video earlier this week that every red light eventually turns green. And so even though we're experiencing these times of not being able to be out and about as much as we used to, this will eventually change. So I really just hope for peace over all of you and staying healthy and being able to spend time with your loved ones. And when things are not feeling uncomfortable, we really want you to seek counseling. We want Bridging Hope to be an option for you or many of the other great mental health agencies in the Twin Cities. So thank you so much for watching. I will also upload this on YouTube, so please follow us on YouTube and subscribe and click the bell. And we will continue to keep doing videos with different mental health tips and helpful things to keep us all at peace and hopeful. Thank you for watching.